All right, guys, it's Dennerol time. So you've heard us talk about this before, but now as you're kind of more, going through care, it's really important to start really changing the curves, changing the biomechanics, and that's where you see a lot of our before and afters on the clinic. I mean, that's what we're known for is really helping to get that curve back. Okay, so the Dennerol is going to be an instrument that you guys are, or tool that you guys are going to use at home every single day. Okay, and we'll explain all this on this video. But what we're looking for, if you can kind of zoom in here, so, obviously people coming in with straight necks, we got to get the curve in, okay? And that curve is so important. It's your shock absorber, and it takes a lot of strain off the body. So what the Dennerol is going to do, and you'll be able to, it says literally on here, shoulders this side, and we'll show you placement here in a little bit, but you're going to have that Dennerol right underneath that neck. So this person would be a mid-neck placement, where it's going to go right in that mid-neck. They're going to be laying on it, which we'll show you here a little bit with Dr. Wayne. And then you're gonna follow the chart to get the results, okay? As you stay consistent, these have been clinically proven to really help get that posture back, okay? So quickly, so you can kind of understand what this is gonna come with. When you look at this, there's a chart that you're gonna follow, okay? So it's gonna start you off at 3 minutes, 4 minutes. This should be on the refrigerator, and you should be marking this off to be able to celebrate after the 50, okay? Now, if for some reason you're getting too sore, if we're doing this consistently, go ahead and decrease the time, okay? You don't have to keep moving forward if you're getting too sore. So then just write your actual time and then keep moving through this, okay? Also on here, it's gonna talk about placement. Lower neck, middle neck, upper neck. I just showed you lower neck on that poster, but us providers, we will, via your x-rays, we'll show you exactly where it needs to be, okay? That is the important part. Don't go buying one of these off Amazon and just doing it. It's precision, okay? We need it in a certain area to make sure that we're going to maximize your results, okay? So Dr. Wayne is going to go ahead and, you want to start with cervical first?
We'll start with cervical.
Okay, so he's going to start with cervical. We'll go with let's go with the mid-neck placement.
All right.
So he's going to go with the mid-neck placement, which is going to be kind of right in the middle.
Pushing it firmly against the shoulders, and just letting your head drop back. Now, a good thing to do is to bring your chin down and push back as well, and not just let your head fall all the way back. You'll get more benefit like this. And again, you're just gonna lay and relax. Bending your knees helps take pressure off your low back while you're in this position. And we'll get to that with the lumbar one as well.
So then you would just follow the chart, like I said, time-wise, set a little timer, and then can you show them how to get off of that?
So to get off, arch the neck a little bit, pull it out, and then
and relax. Perfect. So next thing we're going to do is, and one thing too, guys, I'll get you after you come off the floor, please roll to your side to come up. Don't do a sit-up, because we just really worked on, opening those discs and those ligaments. The last thing we want to do is do a flex. So really come to your side to get off. Now we're going to show you a low back. So same thing on the low back. Depending on where we tell you to place this, we'll decide which way this goes, okay? So do you want to do, you actually do this one, which,
I do.
Do you do a mid, or where do you do?
We do mid, yep.
Okay, so Dr. Wayne will show you another mid for the low back.
So with the mid, to place the Dennerol, you're gonna arch up, slide the Dennerol underneath, right into the middle of the low back, and again with your knees bent, drop down.
Yeah, and sometimes like this one, when you first start, you can really feel this one. Okay, so just kind of ease in. I would say like Dr. Wayne talked about, like keeping his legs bent, keeping some of that pressure off is really important. Any other tips on this one?
When you're getting off, you're gonna do the same thing as how you got on. Arch up, remove the Dennerol, relax for a second, then we're gonna turn to our side, to get up.
Yeah, so instead of doing that sit-up right away, it's really important to get to your side, because this is doing more than you think, as far as like, it'll hydrate a disc, it'll bring water and nutrients back into it, plus it really helps us consistently, as we stay consistent with it, really change biomechanics. And at the end of the day, that's fixing the cause of the problem, so that's the important part. As far as, here's one thing I learned with patients, a little tidbit, and then I'll open it up to see if you guys have any ones. But one thing I've learned is, it's actually better, or patients respond better when they do this in the morning, okay? Versus if they do this right before bed, sometimes they're waking up stiff, which makes sense because you're stretching and then you just go stay in one position for a long period of time. So I would really recommend, if this could be in a morning routine or a lunch routine, so that you have plenty of time throughout the day to loosen it back up. Any other tips for you?
If you're getting too sore doing it on a hard surface, move to a softer surface, carpet, something like that. That'll help.
Yeah, that's a great one. So especially some of our patients that have reverse curves, when it's actually going the wrong way, and they start on this, you're right. They can feel sore. They can feel almost like bruised in a way. So yeah, going to a softer surface helps that decrease as far as how aggressive it is. The other thing to your point there is sometimes putting a towel over it at first can help people with decreasing some of that tension.
Yep.
So do your Dennerols, guys. You've got to stay consistent with this. After you're done, I would say, because people ask me, well, you have to do this the rest of your life? And the answer is, yeah, kinda. Not to this aggressiveness, but I would say at least plug it in, every couple times a week, 3 times a week, whatever, depending on what your lifestyle is. If you're a desk worker and you're sitting and you're not doing, your stretches and things like that, you're gonna have to do it more. If you're doing all those other things, you can do it less. So, any other things I'm missing?
I don't think so.
Okay, do it. That's the key.